Why do we need to pay attention to our cardiovascular health? What happens when things go wrong? Imagine a city. The heart is like the city's central station, pumping life-giving blood like trains on a schedule. It sends oxygen and nutrients to every part of your body, from your brain to your toe. Now imagine if this efficient system falters. The city, your body, starts to crumble. That's what cardiovascular disorders do. We're talking about health issues like hypertension and hypotension, where blood pressure rockets too high or plummets too low. Arteriosclerosis, where your arteries harden, leading to other complications such as angina, myocardial infarction, or what's commonly known as a heart attack. Then there's the congestive heart failure, where your heart can't pump blood as well as it should, and circulatory shock and cardiac arrhythmias, which disrupt your heart's rhythm. Understanding these disorders can help you maintain your heart's health and prevent complications. First, let's dive into hypertension and hypotension, two common blood pressure disorders. Hypertension, or high blood pressure, is a condition where the long-term force of the blood against your artery walls is high enough to eventually cause health problems. It's often dubbed as the silent killer because it can damage your body for years without showing any symptoms. On the other hand, hypotension or low blood pressure might seem desirable, but abnormally low pressure can cause dizziness and fainting or indicate serious heart, endocrine, or neurological disorders. So what causes these conditions? Hypertension can be a result of various factors like unhealthy lifestyle choices such as poor diet, lack of exercise, and smoking, or it can be genetic. Hypotension, though, is often a symptom of an underlying health issue like heart problems, endocrine problems, or severe infection. The effects of these disorders are far-reaching. Chronic hypertension can lead to heart disease, stroke, and other complications. Hypotension, while less common, can cause inadequate blood flow to the heart, brain, and other vital organs, which can be a life-threatening situation. The symptoms of these conditions can range from headaches, shortness of breath, dizziness, to chest pain, and even loss of consciousness. It's vital to get regular checkups to monitor your blood pressure and catch any potential issues early on. Maintaining a balanced blood pressure is crucial to your overall cardiovascular health. Next, we'll explore arteriosclerosis and angina, conditions that affect your arteries. Arteriosclerosis is a broad term that covers any hardening and loss of elasticity in the arteries. Over time, our arteries can become less flexible due to the buildup of fatty materials such as cholesterol. This is a slow process that often goes unnoticed until it leads to complications. One of these complications is angina, a type of chest pain caused by reduced blood flow to the heart. It's like a warning sign, signaling that your heart is not getting enough oxygen. The pain can often feel like a pressure or squeezing in your chest, and may also spread to your shoulders, arms, neck, jaw, or back. Arteriosclerosis and angina are closely linked. The hardened arteries struggle to deliver enough oxygen-rich blood to the heart, especially during physical activity, leading to the discomfort known as angina. This lack of oxygen can damage the heart over time and may eventually lead to a heart attack. Although these conditions can be serious, there are ways to manage them. Lifestyle changes such as healthy eating, regular exercise, and quitting smoking can significantly reduce the risk of arteriosclerosis and the onset of angina. Medications and medical procedures are available too, to help control symptoms and slow the progression of these conditions. Keeping your arteries healthy is key to a strong cardiovascular system. Remember, prevention is better than cure, so it's important to take care of your heart by leading a healthy lifestyle. Now we'll examine myocardial infarction and congestive heart failure, disorders that can be life-threatening. Myocardial infarction, more commonly known as a heart attack, occurs when blood flow to a part of the heart gets blocked, usually by a blood clot. This can damage or destroy part of the heart muscle. It's like a house fire. If the fire department doesn't arrive promptly, the house can suffer extensive damage. Similarly, rapid response is critical when a heart attack strikes. Symptoms can include discomfort in the chest, shortness of breath, and pain in the upper body, including arms, neck, and jaw. Now let's talk about the domino effect. If the heart's function as a pump is compromised, it can lead to congestive heart failure. This doesn't mean the heart has stopped working, but rather, it's not pumping blood as well as it should be. Imagine a weakened dam struggling to hold back a river. That's your heart in heart failure. The symptoms of congestive heart failure often include breathlessness, fatigue, and swelling in the legs, ankles, and feet. It's a bit like trying to run a marathon with a backpack full of rocks. Your body simply can't keep up. Both myocardial infarction and congestive heart failure can be caused by lifestyle factors such as smoking, obesity, a high-fat diet, and lack of exercise. But they can also be influenced by genetic factors. Treatment for these conditions can range from lifestyle changes and medication to surgery. For myocardial infarction, treatments aim to restore blood flow to the heart. In the case of congestive heart failure, the goal is to improve the heart's pumping function. In conclusion, myocardial infarction and congestive heart failure are serious conditions that require prompt medical attention. Remember, the heart is the engine of your body. If it's not functioning well, the whole system can break down. Early detection and treatment of these conditions can save lives, so take care of your heart because it takes care of you. Finally, we'll discuss circulatory shock and cardiac arrhythmias, conditions that disrupt your heart's normal rhythm. Let's start with circulatory shock, a severe medical condition where the heart is unable to supply enough blood to the body. This could be due to a variety of reasons such as severe infections, heart attacks, or even severe allergic reactions. When the body doesn't receive sufficient blood, it can lead to organ failure and, if left untreated, can be fatal. The symptoms of circulatory shock can include rapid breathing, low blood pressure, paleness, and a weak but rapid pulse. On the other hand, cardiac arrhythmias or heart rhythm disorders refer to conditions where the heartbeat is irregular. It could be too fast, too slow, or just uneven. This irregularity happens when the electrical impulses that coordinate your heartbeats don't work properly. It's like your heart's natural pacemaker getting its wires crossed. There are several types of arrhythmias, with atrial fibrillation being the most common. This condition often involves a rapid heart rate and can lead to serious complications such as stroke or heart failure. Other types include bradycardia, tachycardia, and ventricular fibrillation. Symptoms can range from a fluttering in your chest and a racing heartbeat to a slow heartbeat or even chest pain. Now you might be wondering, what causes these heart rhythm disorders? Well, several factors can lead to arrhythmias. These include heart disease, diabetes, high blood pressure, smoking, excessive use of alcohol or caffeine, and certain genetic factors. Treatment for both circulatory shock and cardiac arrhythmias varies greatly depending on the severity of the condition. It can range from medication and lifestyle changes to medical procedures and surgeries. It's worth noting that while these conditions can be serious, many people with heart rhythm disorders live healthy lives. The key is early detection and appropriate treatment. Remember, your heart is the engine that powers your body. Just like any engine, it needs to work smoothly and efficiently to keep everything running. A regular heart rhythm is essential for effective circulation and overall cardiovascular health. Now that we've explored these disorders, let's summarize the key points. Firstly, we delved into hypertension and hypotension. Hypertension or high blood pressure can lead to serious complications like heart disease and stroke if left unchecked. On the flip side, hypotension or low blood pressure, although less common, can cause fainting and dizziness, impacting daily life. Next, we discussed arteriosclerosis and angina. Arteriosclerosis is the hardening and narrowing of the arteries due to plaque buildup, which can restrict blood flow and oxygen to your organs and tissues. Angina, a symptom of underlying heart disease, is chest pain or discomfort caused by insufficient blood flow to the heart muscle. We then moved on to myocardial infarction and congestive heart failure. A myocardial infarction, commonly known as a heart attack, occurs when blood flow to a part of the heart is blocked, often by a blood clot. Congestive heart failure, on the other hand, is a chronic progressive condition that affects the pumping power of your heart muscles and can lead to fluid buildup in the lungs, liver, and other body tissues. Finally, we covered circulatory shock and cardiac arrhythmias. Circulatory shock is a life-threatening medical condition where insufficient blood flow can result in cell damage and a variety of serious complications. Cardiac arrhythmias, or heart rhythm problems, occur when the electrical impulses that coordinate your heartbeats don't work properly, causing your heart to beat too fast, too slow, or irregularly. These disorders underscore the importance of maintaining cardiovascular health. Regular exercise, a balanced diet, and routine checkups can all contribute to a healthier heart. Additionally, understanding the signs and symptoms of these conditions can aid in early detection and treatment, potentially saving lives. By understanding these disorders, you can take steps to protect your heart and maintain your cardiovascular health. Subscribe for more.